Yes, please.
So I'm Joseph Karanja, and I'm a PhD student from Arizona State University, and I'm going to present on the implications of model types and input variables for understanding heat health outcomes. And I'd like to start by acknowledging my dissertation committee for guiding me through this research. So I'll start by giving the research context to my research. And heat-related deaths continue to rise in the Phoenix metropolitan area, and specifically between the year 2021 and 2022, we saw an increase of about 25% between the 2 years. And so there is a need to understand these processes, the special processes and drivers that determine vulnerability, and also the scale of operation of these drivers. And then currently from the literature, there isn't a consensus on the key drivers and processes that drive heat health outcomes. And one of the reasons is that each geographical neighborhood seems to have its own specific nuances and specific attributes that contributed to being classified as being a hotspot or being a key determinant of vulnerability. And hence, the geographical disparities between neighborhood is what I'll refer to as spatial non-stationarity or spatial heterogeneity throughout my presentation. So the key takeaway from this diagram is that we've got a suite of modeling decision criteria that influence our understanding of vulnerability, starting with the choice of variables, whether we are looking at environmental variables or socioeconomic variables, or whether we are looking at the statistical association of variables vis-a-vis the conceptualization of the associations between these variables. And of course, we've got other modeling approaches such as approaches that purely look at the physical aspect or those that look at the social economic aspects. And we've got variations of combinations of the physical and the social economic, and then also integrating heat health outcomes into that. And then, of course, we've got a suite of statistical transformation techniques that have got a bearing on how we understand vulnerability. But key among all these is we have used GIS as the infrastructure for visualization of vulnerability. And hence, to me, or one can make a case that when we're determining variability as vulnerability, it's a classical geographic information science issue. And so we need to contextualize the issue of geographical context and scale whenever we are coming up with vulnerability maps. Geographical context in these, in our research refers to the intrinsic locational attributes or characteristics that determine what really predisposes people, what determines a certain location or a certain population as being vulnerable vis-a-vis not being vulnerable. And so at this point, it's crucial to interrogate how do the confluence of statistical, methodological, conceptual, and GI science consideration influence heat response, because the key attribute or the key influence of science is to come up with targeted intervention, moving away from uniform intervention to targeted intervention by specifically looking at the most vulnerable locations and populations. So the research questions given the research context. One is what special processes explain the frequency of heat-related 911 calls for the city of Phoenix? For instance, socioeconomic, how do we compare socioeconomic versus physical variables and their confluences? Secondly, how does heat vulnerability manifest at different geographical scales in Phoenix? For instance, at neighborhood level or at the citywide scale level? And how do variable selection and model design influence the understanding of heat-related 911 calls? In our presentation, we're going to look at principal components-based models against original variables models. And so the key objective is to understand the role of geographical context, refers to the intrinsic locational characteristics, and then physical and social economic processes that systematically contribute to heat-related 911 calls for Phoenix. In terms of data description, our outcome variable was the 911 calls, which are coded specifically for heat-related 911 calls. And then for explanatory variables, we had 41 explanatory variables, 4 of which were physical variables. In this context, the 4 physical variables were land surface temperature, which is the LST, the vegetational index, the NDVI, the built-up index, which is the NDBI, and the bareness index, which is the NDBAI. Of course, all these variables have been informed by literature from vulnerability on heat. For methodology, we basically had 2 primary methods. So the principal component-based model and the actual variable model. And this reflects the spectrum of modeling decisions that are undertaken when it comes to studies that focus on vulnerability. And so it's good to pick up from here and see what implication does it have on how we eventually determine locations and populations as being vulnerable or not. And then For each of the principal, whether it's a PCA-based model or an original vulnerable model, we also had two other layers of modeling at the global and at the local level. And in this context, I know we've got audience that that are specialized in physical modeling. And in this context, I'll want to reorient your understanding of global and local. The global model, an example of that is the ordinary least squares, which aggregates based on the mean values. But the local model has got two distinctions from the global model. One of them is that it has got a term where you're able to characterize the geographical context. And to characterize, or rather to compute the geographical context, you require the standard deviation of the outcome variable and the local intercept, and then multiplying that, and that quantifies the geographical context. And then for the second distinction is that the local model allows us to determine the covariate specific bandwidth, which tells us the scale of operation, which is really important for coming up with targeted intervention measures. And so one thing that I want you to pay attention to at this point is that we retained 11 PCs, which accounted for 70%, around 71% of the total variance. And we know from vulnerability literature is that there's always a justification given for including the principal components by the amount of variance that it explains. So pay attention to that because it has got ramification on the kind of conclusions we're going to derive in the subsequent slides. So some of the results for the PC and the variable model at the global level. So the three most important variables in the PC analysis were populations without high school diplomas, non-US citizens, and then populations that are employed in primary productivity. And then there's this second bullet for the PC model that we've got populations over 65, users of public transport, and populations below poverty, population of vacant houses, those without health insurance, and those who do not speak English very well as one of the critical, these are some of the critical variables that are considered to be indicators of vulnerability, but these do not show up as being crucial in the PC model. In the actual variable model, surprisingly, that the physical models or the four physical models that we used were not statistically significant at the global level. And in fact, the land surface temperatures and the vegetational index could not even pass the test of multicollinearity. And then here we have more details about the global models. Here we have an illustration of the residuals. And the key takeaway here is that the actual variable model had less variance than the PC's model. So it predicts much better compared to the global model. And then when we look at the other dimensions of comparison, we can see the R squared of the actual variable model is 33, around 34%, while for the global model is 28%. And remember, we had a percentage variance explained for all the 11 PCs as 70.5. And so you can see inconsistencies between the key drivers of vulnerability when comparing the PCA-based model and the actual variable model. So both the choice of the model and input variable influence the understanding of heat vulnerability. At the local model, these are the comparison. We see an increase in R squared for the actual variable model from around 33% to around 55%. And then for the PC-based model from around 28% to 51.3%. And hence, that is evidence that there is local variability of some of these drivers or processes that define vulnerability. And then remember the 7 variables that were significant for the actual variable model. So we had one unique variable in our model, which is homelessness. And remember, homelessness is one of the variables that is really significant, but it's not captured by conventional data sets, like census data set for the case of the US. And so most of the vulnerability studies that focus on only census data sets are not able to incorporate the homelessness variable. When we compare the other 6 variables against the homelessness variable, we see that homelessness comes out as the single most important determinant of heat-related 911 calls for the city of Phoenix. And then here we have plots of significant parameters for variables. So this is the actual variable model. And one of the things here is to pay attention to the geographical context, which means even if you do not consider any of the variables, the intrinsic locational characteristics will predispose populations and locations around this area, which is southern Phoenix, to exacerbated heat vulnerability conditions. And then this is something that you cannot achieve through global modeling because you're not able to map out only significant parameters that are locational specific. So we are trying to move away, remember, from uniform interventions to targeted interventions. Again, here we have got plots of significant parameters for the PCA-based model. And then we are able to see that there is the geographical context seems to be a key determinant for both models, whether it's a PCA-based model or an actual variable-based model. And so this is the beauty of trying to model at the local context and capturing the geographies of variability at the local level. And so the key takeaways, one of them is that a high percentage variance in the PCA does not automatically translate to better model fit. And the argument that is always there for the PCA is that you are able to retain as much information as possible by transforming these variables into orthogonal components. And that doesn't seem to be the case for our model. Secondly, there's inconsistency in the key drivers of vulnerability when using a PCA-based approach vis-a-vis the variable-based model. And then heat proxies from satellite datasets may not be reliable for understanding heat health outcomes. And we can have several speculations as why that is the case. Maybe it's how we discretize data from raster data from the images and then contextualizing that into polygons or point sources. And then the key finding is that both the choice of input variables and model type influence the understanding of heat health outcomes. Thank you for listening to me.
Any short question?